we get started and allow folks to just keep on coming
Sure.
as they come? Cool. Let me get us started with just a little bit of prep, and then I'll turn things over to you, Anne. So welcome everybody for being here. We're glad to have this, I think this is the 5th Ask session. So it's kind of fun and exciting and a good place to ask questions for folks that are interested in the topic. And tonight's topic is, what is telemedicine and how does it work? And what is MyChart, or those kind of online forums that we can use to connect with our providers. So we're gonna have an hour to ask questions of Anne Brooks, who's a nurse at Frodtert in the Medical College, infectious disease, is that correct?
Mm-hmm. Yep.
Okay, good, that's cool. Got to get the whole thing in the right order. But you are ready to roll with lots of questions. But let me just do a couple of tidying, housekeeping. We just wanted to thank our funder, who is the Advancing a Healthier Wisconsin Endowment at the Medical College of Wisconsin. So it's a partnership between Forge and the Medical College's Inclusion Health Clinic. So we're excited about this kind of really quick ramp up in our project start, and we're hoping that it will continue to ramp up and get more exciting for more folks. So I think I put in the chat box that we're recording today so that folks can view it later, or they can share it with friends or wherever it needs to go. So if that alters your desire to speak or include your voice, please feel free to use the chat box and we can read the questions for you if you'd like to remain a little bit more anonymous. I think that I'm looking down the attendance list, and I think most of you have been on a Zoom call before, but could we just practice the raise hand feature? Can folks just raise your hand, click on the button at the bottom? Excellent, almost everybody. And if you're on a mobile device, I don't know where it is. It's a little bit harder to find on mobile devices. So we have half of you with your hands up, which is cool. 2/3, excellent. Perfect. Can we try doing, finding the chat box, just to make sure that everybody can get into the chat box? How about typing in, when was the last time you engaged in a video chat with someone? So it could be FaceTime with your sibling, or could be with a provider. Somebody saying 2 days ago. Last week, Friday. Yep. So it looks like a lot of us have had fairly recent contact through using video to communicate with other people. So that's really cool. At the end of our session, I'll share with you a little bit about what's coming up, but I wanted to make sure that we get started and have a lot of time for your questions. So the time is set up really to ask questions for Anne, and if Anne doesn't know the answer, which is possible, even though Anne knows a lot of things, I bet she will find the answer for us, and we can feed that back out. So, Anne, can you introduce yourself and share a little bit more than where you work, which is?
Sure. Sure.
Cool.
My name is Anne Brooks. I am a nurse at an infectious disease down at Frodtert, which includes the Inclusion Clinic. I've been there since January. My other job, I work there part-time. My other job is at a primary care clinic with Frodtert out in Brookfield. So I've been with the system for 4 years, just with the inclusion for a little while though. So today we are going to talk about video visits first, and then we will get to MyChart. So we're going to keep it casual. So if you guys have questions, please make sure you raise your hand or throw them in the chat box, so we can kind of just use that to guide our talk. So video visits have been around for a while. They just haven't been quite as popular as they are right now because we can't, well, not that we can't, but we just don't want to bring healthy patients into the clinic to reduce people's exposure to COVID. So we are switching a lot of our visits in primary care and at our inclusion clinic into video visits. They are private conversations similar to this with your provider. You are able to talk about just about anything. We do problem visits on video visits. So in the primary care clinic I work in, even if you have like abdominal pain or a sore throat, you can set up a video visit with your provider. They can talk you through your symptoms and the next steps on figuring out what is going on. They can prescribe medications if they think you need something. So if you have what you think might be a sinus infection, they can talk to you, send antibiotics right away, offered to your pharmacy for you. You can do behavioral health visits over video visits. I know it might seem a little odd, primary care or behavioral health, to have a, an hour-long, maybe 45-minute chat with your provider over video, but they should be private and confidential. Even though it's on video, we still have to follow HIPAA guidelines. So you should be able to feel safe telling your provider what you need to tell them. They are great, and I think they're going to be kind of the wave of the future. Like, I think we're going to look more to video visits even after COVID is gone. And it's a great tool to be able to use if you have transportation issues and you can't get into your provider's office and they want you to follow up regularly with them. It's a great tool to have available to you so you can stay in contact with your provider and their team. You can use them, that way for, say you just go in once a year, maybe for like a hands-on physical, because nothing really, it beats that. The doctor is still going to want to see you potentially once a year to do a full head-to-toe physical. But if you have to do any kind of follow-up, so if you're doing like hormone replacement follow-up, you can do that, especially if your doctor wants to see you every 3 or 6 months. You go in once a year and then maybe you just do the follow-up through video visit. Your primary care provider might want to see you every couple months for any underlying conditions, if there are any. Again, it's a great way to do follow-up. Any questions about video visits? Michael, do you have anything?
I do, and I'd like to see if other people do as well. I had a couple questions for you about privacy. So we know that like on the provider end, there's going to be a lot of privacy. So I'm curious if you could talk about a couple of things about privacy on the consumer end. So somebody might not be out to their family members that they're living with. Okay. And so how can they try to find some privacy in their own space to have real conversations with their provider?
Well, I would think definitely, in a quiet, closed room, that you would feel comfortable being able to speak to your provider. I think everything on both ends should be private through whatever system they're using, so you don't have to worry about that. I think it's just finding a space where you're comfortable to talk. So, I think anybody isn't going to want to, like go to Starbucks to talk about their health. But if you can find a space that has good, that you can get internet connection and that you feel comfortable talking, is your best bet.
So part two of that question around privacy, I think that, a lot of times we have a lot of the trans community is living in, small spaces with people that they may not know very well. So with roommates that, are not really close family, and people may not know that they're trans, or they may not know specific aspects of, their bodily reality. And so again, the same question of like, how do we get privacy when they may not be able to go to a separate space? And nobody can go to Starbucks. So,
right.
Like,
not right now. Yes,
not right now. So I mean, like, I guess I'm kind of probing to, I was thinking about this, but where I would go, like, could we go outside? Well, that removes some level of privacy, but it might give us more privacy than what we have in our home if we don't want somebody to listen.
Right. And as long as you have, if you need to be on an internet connection, as long as you have a Wi-Fi outside with whatever device you might be using, you can use your smartphone, you could use a computer, a tablet, a Chromebook. As long as you have access for that connection, that would be fine. I guess I'm not sure where
Yeah,
else you
right.
could go.
Right. Yeah, it wasn't meant to be a trick question. It's just,
No.
it's one of those things that I think about with the trans community, that a lot of folks are living, with multiple folks under the same roof, and people don't
Yeah,
necessarily know each other's business, and
yeah.
they don't have to.
Well, and I think, for maybe like hormone replacement follow-up and that, like it definitely, if you want to keep that private, right, like definitely making sure you are finding that space wherever it can be. It could be the bathroom, in a room, or just trying to schedule a visit for when like the least amount of people will be where you're staying, and using that time then to talk to your provider.
Cool, thank you. Like, again, I didn't mean to trick your question, but
Oh, sure.
it's one of those things that we just have to think about sometimes, and it's
No,
a new
that's true.
world, so
It's true.
we do have to think about it. I'm wondering if the folks that are attending have questions about video calls, telemedicine, before Anne moves on to looking at MyChart.
Well, I see Heather has a question on there about how expensive the video visits are right now. What I can tell you, and I did a little research this afternoon, I know Frodtert right now is no cost to patients. So even if your insurance would have a copay or a deductible, Frodtert is not charging the patients that amount. And it's just because we're transitioning quickly into this world of video visits, and we're trying to accommodate patients as much as possible. Aurora, I think, had where it just went to the insurance company, and then you were responsible for copay or deductible. And then Ascension had $20 video visits. Now, after COVID is done, I'm not sure how billing will go for visits. I'm going to assume they'll probably less than an office visit, but they'll have to go through your insurance, and then you would be responsible for whatever was left from the insurance didn't pay for. The community health centers, I didn't see anything on their websites about video visits, or if you go to a private physician that's not associated with a system, then I would just call their office to see what they're doing right now for video visits and the cost.
And then a follow-up question that I'm seeing in the chat is a really good one, which is what software is used? And in particular, is it Zoom or is it something else? And so I know one of those conversations that you and I had before we started, Anne, was something that I think would be useful to share as well.
Yeah, I think right now, I know when I was going through Aurora's video visits, they are using a Zoom platform, which I'm sure they have to have all the privacy protections in place. And then Frodtert's are through MyChart. So it's whatever format they're using for it's through the Epic charting system. So whatever format that is what Frodtert and I think Wheaton is using. Columbia St. Mary's, I'm not sure what they're using. And then we do have, Frodtert just started, and it was approved this week, where we have video visits that we can do through a program called Doximity. And it would be if you don't have access to a computer or Wi-Fi, or internet, but you have a smartphone. The doctor texts you through the Doximity, this program. And then you click a link, and then you're able to do a video visit that way, but you have to have a smartphone with a camera.
Sorry, a couple of other questions, it looks like. Yep, sorry about that. Hang on a second. So the one question was, how do you sign up to use telehealth?
Okay, you have to go through MyChart for some of them. So that we'll talk about in a little bit, and how you can do that through MyChart. And then I'm not sure some of the other systems, if you go to their websites, they have links to get you set up for video visits. So that I would recommend doing that. If your primary care doctor is through Aurora, it's pretty well laid out on how to get those set up.
Cool. So another question that's in the chat is kind of a two-part question. One is is the Inclusion Health Clinic taking new clients, new patients?
Yes, yes, we
That's
are.
a yes. That's an easy one. And so can somebody initiate care through telehealth?
Yes, definitely. We can do
If they
that.
don't have a MyChart, how do they get going?
I would call the Inclusion Clinic. That phone number is 414-805-2018. They can get you set up for a visit, and the schedulers can get that visit set up as a video visit for you. And that's one thing too, there's numerous ways that you can do this. I mean, you can either go online and set up, or you can call the clinic itself and they can schedule you a video visit. What they will set up a new patient appointment for you, and then they can give you, I believe they can give you information right away to get set up for MyChart through Inclusion Clinic when you schedule your new patient appointment.
That's great to hear. I know it used to be to sign up for MyChart, you used to have to get a paper mailing with a
Not anymore.
or something like that. Not anymore. Okay,
Not
good.
anymore. You just
That's
need
really
a code. Yeah, and we can do that for you when you call.
Perfect. So another question I'm seeing in the chat is if I have a problem visit that requires a provider to examine me, like a skin rash, for example, can providers do any visual exam during telehealth?
Yes, if you are comfortable with that, they can do that. We definitely, something like a rash, if it's in a spot where you can get a camera to be able to see it, we can do that. The things that we're really bringing people in for right now would be, like a worsening, like I had a sore throat, we already tried some antibiotics, it's not getting better, then you need to come in and we need to like swab your throat, like stuff we can't do over a video. We are bringing patients in that, maybe we have tried some stuff over the phone or on a video visit and it's just not working, and then we have to examine you. So that's the kind of, stuff that's coming in. Things are changing every day though. As restrictions get, less, we'll be able to bring more patients in. But we can always, if you can't get to us for some reason, we can always start with a video visit.
Cool. And a kind of a follow-up question to the, can a provider look at a skin rash through a televisit is, if the person's saying like, I don't feel comfortable removing my clothes or sending an image of my body online, how can that be addressed?
Well, then I would, if it's something you're not comfortable with, and there's plenty of patients that are out there that aren't comfortable with video visits yet, we can definitely talk about, you can either talk to the nurse in the clinic or we can bring you in. If it's a matter of that, you're like in a living situation where you don't want to, potentially expose anything, or you're just not comfortable, showing certain parts of your body on a video visit, then you can just need to talk to somebody at the clinic and we can work around that.
That's great. Cool. I don't think I missed any other questions in the chat. If I did, will folks raise your hand or repost your question? So another question, if I have an in-person visit due to some unforeseen circumstance, for example, we get 2 feet of snow, could the visit be covered to a video one?
Yes, yes. And now, so up until this point, we weren't able to do that for a lot of patients because only certain insurances were covering video visits. But now, again, because of COVID and the world we're living in, all the insurances are pretty much doing video visits. So that is definitely something in the future that if it would come up and you were due to come in and you're not going to make it in, you can call the office and say, hey, can we do a video visit instead of me coming in? As long as it's not for, something that the doctor is definitely like, no, I want to see you for that. then yeah, that shouldn't be a problem after this time in our life.
Great. So a person's asking, how long does it take to get an appointment? So I'm presuming that means at the Inclusion Health Clinic.
At Inclusion Health?
Mhm.
That's a good question. I'm not sure how far out we are scheduling new patient appointments right now. The last I had heard, it had been a couple weeks, at least like 3 or 4 weeks, but with things of changing with going to online, or video visits, it might be different now. We have a couple primary care providers, and we are adding another primary care provider this summer. And then a couple of our doctors are adding more hours this summer also. So we will have more availability as the year goes on.
Excellent. So another question that has come in privately is someone is saying, I'm embarrassed about my living situation. So I'm embarrassed about where I live, or my house isn't clean, or I think there's kind of an underlying issue around class. And so people are worried about somebody seeing what's behind them on a video call. So I guess that might be the same as kind of like I'm worried about the people that I live with.
Yeah.
But how can people, think about that?
Well, we shouldn't be judging in healthcare, right? Like we are here to provide care for you and to help you live the healthiest and best life that you can. So we shouldn't have judgment on your living situation. Again, I mean, if it's something where you could, find an area in your house that you're okay with, or stepping outside, as the weather gets nicer, if you can go out onto a porch, as long as you have, as long as you're able to connect, then that would be fine. But just healthcare providers shouldn't be judging you on where you're living. We're supposed to be, just doing what's best for you. So.
And I totally
I'm sorry
hear
if you feel that way.
Right. And I think that those of us who provide services have that belief, but I think, that fear is there for some folks. Like, am I going to be judged for, where I live or how I live? And that's a tough thing. Another question for you is around kind of wanting to have a partner be involved in a video call. And then kind of the opposite of that is, I live with an abusive partner and I don't want them to be involved. How can we screen out for that? Because a lot of times in-person visits will screen out an abusive partner.
Yeah, I think if you want a partner involved, I think I know I was reading on Aurora's website, they have a way that you can invite other people into the call. How it works on MyChart, I'm not sure, but you can definitely have them with you. Whoever you feel comfortable with, either hearing the information that you are getting, or that they might have questions and they want more information, or the information you want to share, that should be fine. But that is completely up to you. As for like someone getting your information that you don't want them to have, there shouldn't be a way for them to access your information unless you give them like your MyChart sign on, or again, trying to schedule a video visit then when they aren't around, maybe if they're at work, or you have a little chunk of time. Generally, some of the doctors that are in my primary care clinic that I work at used to run behind, and they are not running behind anymore with video visits. So generally they're running on time. So if you have, this small window of time that you need to talk to your provider, because that's the safest time for you to talk to them, there's a good chance that will be the scheduled time that you see them. Does that answer the question?
It does, yeah, it does answer the question. And I think that, when we look at abusive relationships, sometimes it's really hard to navigate that, whether it's in person or on video. And, that's just a reality for, a percentage of folks. So, it's just in a different format now when we're doing video calls. So, that works.
And it might actually be a little easier, because you might be able to schedule a time when that, your partner is not around, and you might be able to to actually, you know, get to talk to your provider on your own if you need to.
Yeah. And I'm seeing a question in the chat, which is a really good follow-up to this one, which is, can someone join telehealth call from another or a third location? So, you know, my partner's at work and I'm here and there's a doctor there. So like, you know, can all three connect?
That's a really good question. I'm not sure how to do it through Frodtert. I'd have to look into it a little bit more. It's probably on our website. I could get that information out and we can put that out though. But like I said, Aurora, I know when I was going through their website, they had where you could like it's because it is a Zoom call, so you could give them the code, somebody else the code at a different location.
That's great. That's great to hear. And I think the question is being asked by an advocate. So it's like, you know, as an advocate, how can we help folks if we have written permission? So
that's great. Yeah, no, we can definitely look into that for Frodtert, and I can get that information to you guys, and we can get that online.
Lovely. Great. Are there other questions about telehealth before we move on to MyChart? I'm seeing peeps. Let's move on and talk about MyChart.
MyChart. Okay, I'm gonna attempt to share my screen now.
And I'm gonna hop off video so that it's cleaner for folks to see. And
okay.
And just so people know, you can kind of scroll your screen. So if you want to make the video part bigger, you can do that, or make the screen bigger, you can do that as well.
Okay, did it kick me out? Okay, so we're going to talk about MyChart, and I'm actually going to sign on to MyChart to show you guys kind of what it looks like. So this is off the Frodtert webpage, and most of the healthcare systems have a link right on. Am I still on?
You look good. It's
okay,
good.
Okay.
Yep.
I'm like, oh man, don't fail me now, Wi-Fi. Most of the systems have a link right on there, and the community health centers in the area also have a link on their homepage for you to go into your MyChart account. Frodtert has an app you can download on your phone that is for MyChart. So we will. And it's kind of a nice way to get a hold of your provider. You can do a lot of things on it. Oh goodness. Well, it helps if I spell my own last name right.
These are exciting times when we have, you know, passwords that we have to remember and
I know,
names that we have
so
to
many
remember.
of them. Okay, here we are. So this is what your MyChart account will look like. There are a couple of functions that I really like, and being on the office end of it, especially right now, again, because of the coronavirus and because we're not bringing so many patients into clinic, a lot of clinics have had to cut their support staff, including nurses. So, and the front end staff sometimes who answer the phone. So sometimes it's hard to get through to your primary care provider, or you're on hold a long time. And MyChart is kind of a nice way to get a hold of somebody in the office. So here under messaging, you can like ask a question. So they will have like a new medical question. So you can hit on that. It will come up. It'll be like an email basically to your primary care provider's office. So we definitely don't want this used. Any healthcare system or provider does not want this used like if you're having symptoms that you need to talk to somebody right away, like abdominal pain, chest pain, shortness of breath, anything where you need to talk to a nurse and they need to decide if you need to come in or you need to go to the emergency room. It should not be put in a MyChart. If it is other questions you have about maybe like medications or some lingering symptoms that you've had for a while, you can definitely put that in a MyChart. And we generally respond to those. We used to be better about almost doing it same day, but now since we have reduced staff, it's about 48 hours that we turn around those MyCharts. In our primary care office, the nurse kind of fields them first, takes a look at them, answers what we can. If we can't, then we put them through to the provider. The provider will then weigh in on the question or concerns, and then the nurse will send it back to you with their response. In some of the specialty clinics, it goes right. It comes into a nurse inbox, but we send them right off to the providers usually. And the providers are pretty good about answering them, especially in the inclusion clinic. The providers do answer their own MyCharts a lot. The other nice thing about MyChart is that you can request your refill medications on here, which is great because sometimes you're just not sure how to request a refill, and you can just click on the medication. Unfortunately, I don't have any meds to show you how to do it, but you can, it goes to the nurse, and then they can look at it, get it set up, send it to the provider, and it can get done, usually within 48 to 72 hours. So it's definitely something where you're ready, you're ready for a refill. You give the office about a 5-day leeway if you can to get that request in. You can look at plan of care, test results. If you had labs done and you want to see levels or lab results, you can do that through MyChart. For plan of care, you can look at, through Frodtert's MyChart, you can look at your last office note visit. So you can actually see the notes that the doctor writes in your chart from your visit. And then it will have the follow-up on what's talked about and when you should follow up, what the next steps are. You can, if you would ever need an immunization record for work, you can pull that up off of here. So that you can take a look at that, and then you can print that as to when you had your last immunizations. You can look at when you have appointments coming up, or if you have tests and procedures scheduled. Here, where it says schedule an appointment, you can do that. This is where you can schedule video visits through here. So you can your virtual visit, you can get that scheduled. It will pop it'll pull up the availability for your provider. If there's something that doesn't work though for your time, you can definitely call the office and try to get it scheduled, because they have certain templates that they use for scheduling for video, through MyChart. So if you're not seeing something that works for you, call the office. You can see upcoming appointments, messaging. You can do your billing. If you need to pay a bill, you can do that online. And then just your profile, it kind of just gives you, where you can answer questions about yourself. I think you can put in there preferred name, your pronouns, and that kind of stuff into there, so they have it for your visit. Questions?
There's a couple of questions in
Excellent.
the chat. Let me just start. Hang on a second. So there's a couple of questions. One is, do all providers use MyChart? So can I add on to that question, which is do all providers at Frodtert, and do all providers maybe across other systems?
Yes. Yes. Everybody, if they have Epic as their charting system, they have some form of MyChart, and it is available to everybody to use. The community health centers, they either have patient portals which is similar to MyChart. It's just that they have a different charting system, and it's just called something else. And then Columbia St. Mary's also has patient portal, which is the same. Like, since I don't have an account there, I can't say if it looks exactly the same, but it should be about the same, where you can message your provider that way.
Excellent. So another question related to MyChart is, somebody's wondering, when they message a provider, can other providers see those messages? So sometimes if somebody has a problem with another provider,
No.
will that other provider see it?
No.
No.
Well, I shouldn't say that. It does, any message that you send does become a permanent part of your chart. So that is a good reminder too, that if you have questions maybe about like a partner, or like in primary care, sometimes we have maybe like a parent that's MyCharting about their child, like that stays part of whoever's MyChart account you're using, that's part of their chart. So you definitely don't want to put anybody else's information into it. Now, that being said, since it does become a permanent part of your chart, if you're having a problem with this particular provider, I would request a phone call, maybe instead of, or maybe you could send a MyChart to say, hey, I need to talk to somebody about something that's going on, just so that, and then that way, if you're talking to a nurse, you don't have to put in quite such a detail as to the problem that's going on with the provider into your chart. So that provider can't go back and see it. If you do put something in there, the message that we send, even if it's any other private information and you just don't want any other provider to see it at that time, the message gets sent to just your provider. Like, we're not going to send it to a different provider in the clinic. It'll just get sent to your provider.
A question about like making a phone call, which is, a great way sometimes to not have a paper trail,
Mm-hmm.
is, I know that a lot of times providers have to chart
Yes.
or record their phone call. So does the nurse's side of thing get recorded?
No.
And will that be seen by anybody?
No, we don't record anything, but we have to make a note usually that we had a discussion. Now, if I'm talking with a patient and they're having a problem with a provider, I am not putting every single detail that you tell me. Now, I don't know if that's across the board for all nurses, but I'm not going to put every single detail that you're telling me about your problem. Now, I might say that you're having a problem with a provider and you want to speak to your provider about that. Yeah, like, I'm going to make it general. I'm not going to put in great detail. And I think sometimes when there's concerns about a certain provider, or your relationship with that provider, even your primary care provider might not put every single detail in your chart, where they're going to maybe make note, and then we'll have to talk to the appropriate person about those concerns that you might be having.
That's great. So another question is around mental health providers.
Mm-hmm.
So, is there any additional privacy around mental health provider communication? So again, maybe other providers don't see those interactions.
It definitely, I think, so if your mental health provider is in a different system, those notes aren't generated. Say your mental health provider is in the Aurora system, but your primary care provider is in the Frodtert system. Those notes, we have a way to get to those notes, but they won't just like be available to us. Like, we're going to have to go into, there's another system that kind of connects all Epic users. So it's called Care Everywhere. And that kind of gives us the availability to share office notes and medical records with other providers that are on Care Everywhere. But it's just not something that we're not going to go looking for it if we don't need it. And that's also like part of a HIPAA thing too, where we shouldn't be in notes and charts that we don't need to be in. So there should be some privacy there. And again, with most mental health provider offices, I'm sure, a nurse is going to field those first. and then answer what they can, and then we'll pass it on to your provider after that.
Let me just ask you a quick question. Are you going to be showing more about MyChart, or is the show and tell done?
I think we can be done unless somebody wants to see something in particular.
Does somebody want, because otherwise I would like to ask you to stop sharing your screen so we can have a little bit bigger view for folks.
Are we good? I cannot stop sharing.
Not quite yet. There's probably a stop share button.
Oh, it's up top. There it is.
Perfect. Great. Because that makes it a little bit easier for sometimes for people to be able to see you better. So let me ask you another couple of questions that are coming in through the chat. So is there a way to get information removed from my electronic health record, like a private message I sent to a provider in the past?
That's a good question. I'm not sure. I'd have to look into that.
Okay.
That's something probably I had to look into medical records that we would have to do that. But I have to try. I could find that information out.
That would be cool. I think that would be useful for folks. I bet that's a common question as well that's in people's minds.
Okay.
And a follow-up question, which might also be an I don't know answer, is provider note or a diagnosis that the client disagrees with.
Well, you can definitely send a message about it. That's what a lot of people do. You know, they don't understand why something was put in their note or a certain diagnosis was put in their note. And we get those questions all the time. So we can definitely, send that off to the provider so they can give you an answer as to why they put that in there. But it is your medical record and you have the right to look at it and you have a right to question it. So it's definitely something you can do.
That's really good to hear. And I think that sometimes trans folks are really concerned about this because, if gender identity disorder or gender dysphoria gets placed in that chart, I think a lot of folks are worried, and rightly so, that their insurance company will see that diagnosis and deny care. So like once it's there, it's kind of like, how does it get removed? And then how do all of the people that have already seen that kind of get it removed from as well?
Yeah, no, I understand that, and that's definitely something we can talk to a provider about. And I mean, we have changed diagnoses and taken diagnoses off of lists because that is definitely something that comes up, in the chart as like a problem list. And we have removed stuff as needed. So it's definitely something you can talk to your provider about.
Excellent. Let me just ask folks if anybody has any questions they want to ask, like by voice. Let me just make sure that we're not missing some opportunities to have a voice question.
Sure.
So if anybody does want to, raise your hand, I will keep an eye on that as well. Otherwise, there's a couple more questions that are in the chat box that we can keep on rolling. So there's questions about how does Frodtert and MyChart handle gender markers, and can the consumer or the client change it?
I want to say, I think that has to be done through medical records. I can double check that too, but I think it has to be done through there's a certain process for it.
Okay, that makes sense. And then the secondary question to that is, and can I change my gender marker if I haven't changed my gender marker legally?
Yes, I believe you can.
Okay. And the secondary to that is without screwing up my insurance billing. So can there be a gender marker that's, for client use and you might be frozen? No, you're not.
No, am I good?
Yep, you're good.
I'm unstable. Okay. I am not sure. I will double check that though. I will get that information to you so we can get that out.
And we can send out a follow-up kind of fact sheet with some of those questions, which would be
yes, perfect.
Cool. So hopefully I haven't missed other questions. Let me ask a question that I had ahead of time before this call, because I don't see any hands up, and folks can keep on asking questions in the chat. So one of the questions that I had ahead of time was like, I can't bear to log onto MyChart because it has my old name. So that was just asked, can that be changed? And now, like with Aurora, I don't know if Frodtert is doing it, but Aurora has your picture taken, and so every time you log into MyChart, you've got your picture that they took on some random day with your name. So people are feeling hesitant to even log in because it's so dysphoric to see their name or their picture. Ideas?
I know The picture, not everybody's getting their picture taken at Frodtert. There are some, we are kind of like 25-75. They were doing pictures, I think mainly for people who are like getting long-term chemotherapy and like that kind of care. So I've seen some pictures and I have seen some without. So that is definitely something probably though that we could easily put a new picture on if they go to it where they're taking pictures for everybody. Then they would have that capability, I would think, to change your picture anytime they would ask. Because I'm sure there's sometimes when you aren't looking great and you're, you know, coming in with the flu and and they want to take your picture. So I think I can look into that too. I can ask some questions and get some information.
That's cool. And like you said, I mean, a lot of us get our driver's license pictures taken and we don't look the way we want to look sometimes. And yeah, so let's take it again. Excellent. So I know the question was asked before. I've just got a couple of questions that I had written down ahead of time. So someone asked about if all the systems are connected. And I think you kind of addressed that. I think that what I didn't hear an answer to was does, you know, Frodtert system connect with Aurora or Ascension? So can providers see things?
Yeah, so we do connect through Care Everywhere. Now we don't connect to Columbia St. Mary's, and we don't connect to all the community health centers. We connect to a couple of the community health centers, I think like Outreach and Progressive, or yeah, Progressive Healthcare, yeah. And we connect with Aurora, we connect with Pro Health, I forgot about Pro Health, and Wheaton. And so they all use the Epic charting system, and then we have to, so let's say if you're a new patient, you come in, we can request your records through Care Everywhere, and that will pull up so we can see like old lab results, we can see old notes, we can see like you can get your medication history, your immunization history. We can get all that from your past chart in those systems. Now, if you were transferring care to us from Columbia St. Mary's or like a private office, then we would have you request medical records to be sent to us so we can get them scanned into your chart. So we have them for future history.
That's great to hear. That's great for some people to hear, actually, because my thoughts about this too are like, well, what if someone is not out in most of their life, but they receive hormones from their primary care doctor, and so that would obviously be charted in their chart with that doctor, but they need to go to the emergency room because they're having chest pain,
right?
And they don't want to be out to that emergency doctor,
right?
Is there's no? It sounds like there's no way to prevent them from seeing that information.
Well, I mean, they could look at information, but I don't know if they would dig as much. You know what I mean? Like if you're in the emergency room, I don't know if they would dig into the chart as much to maybe see some of that, unless it's like right out there in the chart, like in your problem list or something.
Okay.
So I'm not sure like I'm not sure the best answer is for that.
It sounds like it would go back to what was talked about before, like if you disagree with something in the
or if you're asking, you know, if you want something kept private, then it's a matter of, you know, having that talk with your doctor. And I think most doctors should be respectful of that. I'm hoping that most healthcare providers would be. So just have that, you know, just find a physician that you're comfortable with first off to have that conversation with.
Great. Okay. I know it's not going to change what's listed in the medication list, which would be viewable. So that may be a tip off.
Yeah, which is important to know though. You know what I mean? Like if not that most hormones would interfere with anything, but it's definitely something, you know, like if you're, you know, on estrogen and you hear coming out the blood clot, they're going to want to know like why, you know, what potentially could be causing that. So.
And I totally hear that, and I also know from the trans community side that sometimes puts people at in a challenging spot to have to describe or say why they're on estrogen or why they're on testosterone, and that can that can just be uncomfortable when you're already in emergency care or whatever.
Right. Yeah, I get that.
Yeah.
I just hope as, you know, as like we move forward, you know, that things don't have to be so uncomfortable. And I
Right.
hope that healthcare embraces it more.
And I totally hear that. And I think we all know that what we hope for is not always what
I
we
know.
have right now. So,
No.
and fears can be there, whether it's true or not in reality. So, I mean,
Mhm.
those are the hard questions to kind of think about. I missed a question from before, and I was kind of waiting till we got done with the MyChart pieces.
Mhm.
Somebody asked if they have a microphone but no camera on their phone, what do they do for telehealth or telemedicine?
Oh, that's a very good question. I think we would probably have to do a phone visit then, which they're not encouraging right now because we have a hard time, you know, billing the insurance for phone visits, but it can be done. So that would be what I think we would have to do for right now. And then hopefully once, you know, we open up again, then you would be able to come in to see the provider.
Would that be, I was thinking about what you said before about how televisits are free right now
Mhm.
through Frodtert.
Yep.
So if somebody didn't have the ability to do a face visit, you know,
Mhm.
a visual visit, would
Mhm.
that not count as a free visit if it had to be by voice only?
No, I did. I think they are right now. I don't think they're charging for phone visits right
Okay,
now.
because that would seem unfair, but you know,
Yes. Yeah. No. No. There, we have no way to bill for them. We have no way to bill. Like,
okay.
so they're not charging for those, I don't think.
Okay, that's good to hear. That's
Mhm.
really good to hear. I know I just received a first bill from a provider that I see, and they kind of split out the medical bill. So it's the same date of service. It has the telehealth portion of it for
Okay.
80 some dollars, and then the secondary line item, which was actually like the reason for the visit. So, I mean, that's not free for me, but like I'm, you know, but I'm seeing that
Okay.
come in my explanation of benefits as two separate line items. So
Okay.
it's kind of an interesting,
Yeah. Yeah.
interesting world.
It will be interesting to see how it goes forward from here, just because, like I said, I think this is just kind of the wave of the future, and we're going to be doing a lot more through telehealth. Um, so it'll be interesting to see how it kind of goes.
Yeah, exactly. So we've got about 5 minutes left. I have one more small question, and I
Okay.
would again love to see if other folks have questions before we wrap up tonight. My small question relates to something that you mentioned before, Anne, about you know, things become permanent record, and so like if a mom or somebody asks about their kid, it becomes part of that record of whoever
Mhm.
it's with. How do people get somebody to log to be part of their MyChart if they
Oh,
want their partner or their family member on?
no, that's perfect. That's a good question. Thank you. So you can sign a proxy. So you can have somebody else access your MyChart and send messages for you, or you know, to like send your prescription refill. There are plenty of people out there who just give access to their partner, and they just send a MyChart message like they're the patient. We would prefer that not to happen. So we do have proxy paperwork that you can sign, and then if that person is sending a message for you, then they just need to they'll just pop up that they're the proxy sending the message.
Cool. And you said sign the paper. How is that being done now? Is it literally being sent by paper?
I don't know how they're doing it right now. That's something
Right,
else I'll
okay.
have to look into.
Right. The world is really different. It's moving
It
fast.
is,
So,
yeah.
okay, cool. But it can be done, and
Yep.
it'll be done somehow, some way, either through paper or through some magical.
Yes.
Okay,
Yes.
perfect.
Something online somewhere. Yeah.
That sounds great. Any other questions before we kind of review what's coming up this week and check out for the night? I am not seeing anything else, and if we do, I will. I can send you an email, and we can get back to folks with things.
Definitely.
Oops, here's another question. So does a proxy have to be family? Can it be an advocate as a proxy? Is there a better way to share?
I think it can be anybody you choose to be, because we've had guardians, and so I think it could probably be an advocate. I can look into that too, though. Maybe we can put a little tip sheet together to put on the website. But I'll look into it. I'm not sure.
And while you're looking at it, can there be more than one person?
Okay, I will look into that too.
Because I would imagine that there could be, but people have rules all the time, and you never know what they are.
Right.
Perfect.
I can at least tell you Frodtert's policy on it. So.
Well, and that's really good. So I mean, one institution's policy is better than not knowing any. So
yeah,
really cool. Thank you for being here, Anne, and for sharing all the good stuff. Let me just review with folks what's coming up this week. So hopefully folks will be on some of the other events that we're having. So tonight was an Ask event. We'll have an Ask event with Shelley Gregory on Saturday. So same format as this with video to be able to see. And Shelley's gonna be talking about food and food access. So a lot of us are having some troubles getting our food and access to groceries or other basic resources like that. And then Wednesday, Thursday, Friday are Connect events. So tomorrow is going to be a really fun day. Jack O'Grady with Maya Ophelia is a vegan cook chef, and he's going to be coming and showing us how to make vegan tasty food. So that's tomorrow night at 4 o'clock. Thursday at 6 o'clock is a chat-based group, support group. We'll be talking about sleep and tiredness. And then Friday at 4 o'clock is the mystery game day. So we've been playing games. It's been really fun. It's relaxing, not serious. It's just kind of kick back and have a good time. So those are the announcements. Another announcement that I've made every time is that we still have face masks, which are expensive to buy on your own. So we'd be happy to send you one for free. Just let us know and we will send you one. And I think that's it for kind of announcements. When we close out today, you'll get an evaluation, and we really would appreciate your feedback about what worked, what didn't work, and all of that good stuff. So thank you again, Anne, for being here, and thank you everybody for attending. And we'll hope to see you all later this week. Bye, everybody. Thanks.
Bye.
Thanks, Jill.
You're welcome. Thank you back.